What's up, everybody? This is Dr. Zach Baker and Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast. And today we are answering a question from the audience, which centers around patient care. And the question was, what do you really think your patients do or don't care about? And Josh, I know what my answer is, but I would love to hear what your thoughts are and what you've experienced in the past.
I think the biggest thing, and it's not to say that this is not important to at least to have the conversation about, but it largely centers around what the individual is able to do and not do. And I think a lot of times we have conversations about shutting people down, about rest, about all of the things that they can't do. And I think that shifts the focus for the individual in a direction that isn't as positive as if we focus more on the permission side of things. What do they have permission to do? What are we allowing them to do? How are we modifying current routine? As well as communicating to them the forecast. What does the forecast look like? If you're able to do X and Y, we're going to allow you to do this. If we get to this certain timeline from a protocol standpoint, we may be able to do this. If you pass this test, you may be able to do this. I think focusing more on the permissive aspects, areas of which they can kind of move through the gates to unlock new levels as it relates to their capability is tremendously important to creating an overall level of optimism, an overall level of excitement, engagement in the process, as opposed to potentially focusing on all of the things that they are not able to do. And sometimes this takes a reframing of conversation, but you're not trying to be Eeyore. You're trying to be Tigger. You're trying to be Piglet, Christopher Robin. You're trying to present a little bit more of that optimistic side and that excitable side, as opposed to then, again, focusing on everything that we can't do.
No, I love that. And I think of like an injury-specific version of that is, somebody injures their knee, they just come out of a knee surgery, whether it's a total knee, ACL, meniscus, whatever it is, and you ask them to do a quad set, and they're struggling, and they can't do it, and you keep focusing and focusing. Hey, we got to get that quad back. We got to get that knee straight. All right, well, the knee is just one piece of the puzzle. There's still a lot of other parts of their body that are working perfectly fine. Let's figure out how can we get that knee straight where it's not the focal point of the exercise, but it's a part of the exercise. Let's get them in a front plank. Let's have them do a push-up. Let's have them do something they can do while we're working on the things that they are currently struggling to do as well. My take on this, things that patients don't care about, I take a lot of students. We take a lot of students at R2P. We have a lot of really, really good students. And when I say really good students, this past week, one of my students just left. I had 3 people that were disappointed they were seeing me when they came in because my student was no longer there because she did that good of a job developing a rapport with them. So a realization for me, and something that I always used to put a huge emphasis on because I've been in different environments where you have varying amounts of time with patients. Maybe you're a PT, PTA model or PT, PTA tech model. Maybe your hour-long sessions, 15-minute sessions, whatever it is. I used to get so hung up on how much time I was spending with each patient, like to the minute. Was it 40 minutes? Was it 38? Was it 60 minutes? And what I started to realize was patients don't really care about that. They're not watching the clock. They're not watching the minute. What patients care about is, are they getting better? And when they walk through the doors, one, do they know why they're coming in that day? Like, what's the focal point of the session? Is it to get rid of pain? Is it to get more mobile? Is it to get stronger? Is it to reintroduce an activity that they haven't done yet? Did you frame that up well for them? And hopefully you did it at the previous session. Hopefully they left their last session knowing what they're coming back for next week or the next time they come in. Then they walk into the door and they know what they need to get done. Do they know how that's happening? What is the game plan for the day? What are we going to work on? How are we going to work on it? And then at the end of the session, did we make progress towards that goal? Did we leave in a better spot than when we came in? If those 3 things happen, what I have found, my patients don't really care if it is me delivering the session, if it's my student delivering the session, if I delivered the session last time, but now they're seeing another staff member at R2P. Those are the 3 questions that they want to know. Why did I come in today? What are we working on? And how are we going to get after it? And then did I make any progress? And if you answer those 3 questions, a lot of the other little things that you worry about, they tend to take care of themselves. So that question was one that we got fielded from our email. So if you have any questions you want us to answer, shoot us an email. Get in touch. We'd love to hear them. We'd love to answer them. If you enjoyed this episode, please share, like, and subscribe. You're listening to the Strength and Knowledge Podcast. Stay tuned for next episode.